Okay, so I have the H6, H7 anterior sickle scaler. I was trained to use only one cutting edge per working end with this instrument. As I mentioned earlier, you can choose to use both cutting edges, so I'll have to show you that. Right now, I'm pointing to this. Right now, that lower shank is tilting this way. It's tilting this way, and because it's tilting that way, I would use the cutting edge on this side because it would lean against the tooth. So if that's the case, if you choose to do that, then this would be the cutting edge that you would use for all of your surfaces away, and then I would have to flip it to do all of my towards. So once again, on an anterior tooth, our maxillary sextant, we'd be in our 12 o'clock position, 11 to 12, I'm sorry. We'd get on that get ready zone, we'd tip it. Now this is a supragingival instrument. However, calculus is usually right up at that gingival margin or slightly below it. So you do have to get below the calculus deposit at all times, and with just that tip 1 to 2 millimeters, and I would do my assessment strokes like so. And this is basically an interproximal instrument. And then when I get to the interproximal space, right now my shank is parallel to that tooth. It cannot be parallel. Remember, the face is 90 degrees to the terminal shank. Our correct adaptation is 70 to 80. So you have to close that face towards that tooth just a little bit. And if you kind of have that shank covering the mesial edge or the distal edge, you're going to be closed enough so that you don't have the opposite cutting edge hitting the tissue. So I would make sure that I'm closed enough, and I would do a short calculus removal stroke just like we've done everywhere else, and then you'd continue to assess all the way down to that contact or even the incisal edge. I would go to the next tooth and I would do the same thing, coming all the way down and making sure I have that closed a little bit. And have your patient turn their head. And so you're doing your entire anterior sextant. You have your sequence. You're doing all of your surfaces away first. And then if I was using the one cutting edge like I am, then I would have to flip my working end now. And now I would come back and do the surfaces towards me. Okay? And once again, it can't look like that. It's got to be closed a little bit here. And then I would, of course, use my mirror to do the lingual. So I'm not going to actually do the entire sextant. What I want to show you now is how you can use both cutting edges. So if you choose to use both cutting edges, it's going to be up to you to make sure that you close the cutting edge, or the face has to go towards that tooth a little bit more, especially with a shank that tilts. So if I were to do both cutting edges, I could start and do the surfaces toward me, and then I would just rotate on the opposite cutting edge, and now I would go to the next tooth and have to quarter turn that again, and opposite. So in other words, you're going like so for away, rolling to the opposite cutting edge for surfaces towards. So that is a choice that you have, both cutting edges or one cutting edge. Our clock positions are going to be exactly the same as they are for our curettes and our explorer. The difference is that we are not going to be doing a horizontal stroke with a sickle scaler. Because of that pointed tip, we do not want to damage the junctional epithelium. So this is pretty much an interproximal instrument. So we're going to allow you to start just right at that line angle and come across and do all of your surfaces away, and you're going to be coming all the way up into that contact. Now, if a tooth contact is very tight and you get stuck, that means you're using too much of your working end. You need to back it out a little bit and just be on that 1 to 2 millimeters, and you should be able to come all the way up to that incisal edge to get any stain or very thin calculus deposit that might be there. Remember having the patient turn their head, so we don't have to worry about starting midline with our sickle scaler. If you can use the same working end for the surfaces away in the lingual, or you could flip it. It really doesn't matter which cutting edge you use as long as it's going to be adapted properly. To do surfaces towards, it would be the same thing. Remember, I said I only use one cutting edge, and I usually one where it's slanting, and that's fine. But same thing, I get to start right at that line angle, and we're going to be primarily using this as an interproximal instrument, especially on the mandibular anteriors, and we would use our mirror to finish out the lingual aspect of these teeth. Okay?